Dr. Ikenna Omeje, and I'm the lead pediatric heart surgeon for Hospitals for Humanity. And but otherwise, I work at Great Ormond Street Hospital, London, which is one of the leading children's hospitals in the world, as a heart surgeon. As a child, I have always wanted to give back to Nigeria in a certain way. And when I had the opportunity to train as a heart surgeon overseas, and there was an opportunity for me to go to one of the African countries to do some surgeries, I realized that actually I could do more in Nigeria. And the opportunity arose for me to come to Nigeria, precisely to UNTH in Enugu, where I performed a few cases there. So from there, one thing led to the other, and then I was approached by this charity called Hospitals for Humanity to be their lead heart surgeon, and I've been working with them here for the past 2 years actually, and we've done so many cases here in Nigeria. Apart from my elementary desire to give back to Nigeria, I think this is very important because at least 1% of all newborns have actually got some sort of congenital heart disease. So if you take it that maybe over 1 million children are born in Nigeria, you have that over 10,000 children are born with some kind of heart defect, if not more than that. And these children, most of them have no access to any form of health care, let alone advanced surgical treatment. And that is where we come in. So there are so many children who die before the age of 5 because they are not able to access any form of treatment, any form of surgery. And this 21st century, I think it's really a shame that there's no sustainable service in Nigeria. And this is the main reason why we came into Nigeria 2 years ago, and that's why we've stayed, and we're working hard to ensure that Nigerian children actually have access to treatment of their congenital heart disease. Yeah, this is the story of a 6-year-old girl who had a tetralogy fellow. She was very ill and had what we call cyanotic spells. She came in a very bad shape, and we had planned the surgery. We went into theaters, and then we got ready. I opened the chest, and then I found that the anatomy was not as described. It was a lot worse, and in most centers, most surgeons would just close the chest and not do anything for the child. But I looked at it, and then at the spot I had to improvise. I did something which I had never done before to try and relieve to sort out the problem. And it was a situation whereby you tell them, look, I'm doing something, I'm not really sure of this, but whatever happens, this child might not actually survive. So I went in and did the surgery, and then took the child back to the unit. Just a few hours later, the child was awake and asking for the tube to be taken out, and the child got intubated, extubated. That means to remove the tube, the breathing tube, and she was dancing around the next couple of days. And she went home and never had any spells. And from time to time, they still called me to say, "Thank you. What have you done to our child?" I said, "Well, I don't know." So that's a very, very interesting story. Unlike this, in other cases, you go in there, you are sure of what you want to do, and you do it, and you are also more or less sure of the result. But this was a case where, I got to the end of my, professional, if you like, wizardry. It got to a state that I didn't really know what to do with the case. But it so happened that the child did so well afterwards, and a very interesting story that I'll never forget.